ear to start your tour of the ear. Let's begin by discussing the outer ear, the most recognizable part, the pinna, or in other words, the auricle. Now let's take a closer look at the eminences and depressions. Helix, antihelix, antitragus, tragus, crucive helix, crura of antihelix, scaphoid fossa, intertracheal notch, Simba concha, fossa triangularis, cavum concha. So now that we've reached the cavum concha, we're going to slither on in to the external auditory meatus. The external auditory meatus, or in other words, the ear canal, helps warm the air prior to reaching the middle ear. If we divide the ear canal into three portions, the last 2/3 is the osseous portion, and the first third portion is the cartilaginous, which is where the cerumen glands are located. The cerumen glands is where earwax is produced, which helps keep the ear clean. Overall, the pinna collects the sound, and the external auditory meatus guides the sound to the tympanic membrane. The tympanic membrane is the start of the middle ear.
Come here often?
Nah, let's hear what you have to say.
Hi, I'm Breanna. I'll take it from here. So, what goes on beyond the tympanic membrane? Well, once a sound wave reaches the middle ear, the tympanic membrane vibrates the three different ossicles. Let's take a closer look at them.
Alright, so let's zoom in to see the middle ear. Here's the tympanic membrane, and as you can see, there are three tiny bones that articulate with one another. In fact, these are the three tiniest bones in the body. They could fit collectively inside a dime. They are named the malleus, which attaches to the tympanic membrane via the manubrium, the incus, and the stapes. Together, these three bones move in a lever action, which pushes into the oval window, but more on that in a bit. Called an impedance matching system, the lever action amplifies the force of the sound wave and turns the acoustic energy coming in from the outer ear into mechanical energy. In addition to the ossicles, there are 2 muscles, 6 ligaments, and various other anatomical parts of the middle ear.
The middle ear is full of landmarks. To help learn these landmarks, it's easiest to imagine the middle ear as a cube with 6 different walls. Let's point out a few of the most important ones.
Tegmental wall, or superior wall. This roof is named by the tegmen tympani, which is a thin layer of bone that separates the roof of the middle ear from the cranial cavity. Jugular wall, or inferior wall. This floor is formed by a bone that separates the middle ear from the internal jugular vein. Labyrinth wall, or medial wall. There's a lot going on in this wall. Some landmarks include tympanic nerve and the oval and round windows. Remember when we talked about the oval window earlier? The stapes attaches here. Carotid wall, or anterior wall. This anterior wall separates the tympanic cavity from the carotid canal and artery. It has the opening for the eustachian tube and the canal for the tensor tympani muscle. Mastoid wall, or posterior wall, named for the opening called the adytus to the mastoid antrum that connects the tympanic cavity to the mastoid air cells. The mastoid bone, which sits behind the ear, consists of air spaces that help drain the middle ear. Finally, membranous wall, or lateral wall, consists mostly of the tympanic membrane and the bony wall of the epitympanic recess. We cannot see it in this view, but we can imagine that we're looking just past the tympanic membrane. Here's a more realistic look at the walls of the middle ear. In this picture, we can see the two muscles of the middle ear, the stapedius and the tensor tympani. They are cut to allow us to see the rest of the middle ear. Their job is to create tension at the tympanic membrane and dampen the movements of the ossicles to prevent ear damage from loud sounds. So you may be asking yourself, how does the mechanical energy transfer into the inner ear? Well, like I mentioned before, the stapes attaches to the round window via the annular ligament. During the lever action of the ossicles, the stapes pushes into the oval window, starting a chain reaction on the other side of the labyrinth wall.
Now that we've wrapped things up with the oval window, let's go ahead and talk about the inner ear. You look like an ear in headlights.
I'm here to talk about the inner ear.
Oh, okay.
Okay, so what's beyond the oval window? First is the vestibule. The vestibule of the inner ear works as a chamber or entryway to the various sections of the inner ear. In this tour, we'll briefly discuss the auditory and vestibular portions. Let's start with the auditory, or cochlear portion.
So now that we understand that the oval window pushes into the inner ear, let's talk about how that affects the cochlear system. As the stapes rocks back and forth against the oval window, it transmits pressure waves of sound through the perilymph fluid of the cochlea. The round window that separates the cochlea from the middle ear gives the fluid somewhere to go, since its membrane is thin and elastic. The cochlea is a fluid-filled, snail-like structure that contains the organ of Corti, which is the receptor organ for hearing. Let's pretend that we cut the cochlea in half. Here we have the scala tympani and the scala vestibuli. In between the two is the scala media. Within the scala media lies the organ of Corti. When the perilymph is displaced, it starts a wave through these sections. One of the three walls of the scala media is the basilar membrane. Situated on the basilar membrane are rows and rows of hair cells that bend in accordance to the frequency of the sound wave. These hair cells are connected to nerve endings that send nerve impulses via the auditory nerve. Here's a look at what the cochlea would look like if we could unroll it. As sounds travel through the inner ear, the basilar membrane picks up frequencies based on the wave's movement. Certain areas of the basilar membrane show greater displacement for certain frequencies over others. For example, high-frequency sounds with shorter wavelengths show maximum displacement at the base, rather than the apex.
That's a lot of action taking place in the inner ear. However, the inner ear does more than just house the cochlea. It also houses the vestibular system, which is important in helping to maintain our balance and our understanding of our spatial orientation. Let's break down the different parts of the vestibular system.
To simplify things, let's divide the vestibular system into four parts: the utricle, the saccule, the semicircular canals, and the ampullae. The utricle and the saccule contain endolymph within their membranous sacs. On the outside, they are surrounded in perilymph. The utrosaccular mechanism is responsible for interpreting linear acceleration. The utricle detects acceleration on the horizontal plane. The saccule's job is to detect acceleration on the vertical plane. As you can see, there are three semicircular canals: the anterior, lateral, and posterior. Each semicircular canal is responsible for a certain aspect of the angular acceleration. Anterior semicircular canal functions to detect acceleration forward, for example, nodding yes. The posterior semicircular canal functions to detect tilting heads left and right. And the lateral semicircular canal functions to detect spinning. At each end of the semicircular canal is an ampullae that contains the crista, or the end organ that provides equilibrium.
Alright, that's a lot of information about the ear. So before we conclude our brief introduction of the ear, let's make sure we understand how sound moves from the outer ear through the external auditory meatus to the tympanic membrane, into the middle ear, and then finally to the inner ear.
First, the outer ear helps sound funnel into the ear canal and causes the tympanic membrane to vibrate. The tympanic membrane vibrates with the sound. Sound vibrations move through the ossicles to the cochlea through the lever action. Sound vibrations cause the parallel fluid in the cochlea to move. Fluid movement at the basilar membrane causes the hair cells to bend. Hair cells create neural signals which are picked up by the auditory nerve. Hair cells at one end of the cochlea send low-pitch sound information, and the hair cells at the other end send high-pitched sound information. The auditory nerve sends signals to the brain, where they are interpreted as sounds.
I'm Christina, and on behalf of Breanna and Elizabeth, thanks for watching, and we hope that this video has been helpful in increasing your understanding of the amazing human ear.